Keep a favorite toy visible and even a music box or mechanical toy nearby for a distraction, especially if you've got a squirmy baby. Once you've got everything you need ready to go, wash and dry your hands. If that's not possible, give them a good swipe with a diaper wipe. You'll know your baby peed with a disposable diaper often by the liquid-sensitive, color-changing stripe on it, and with a cloth diaper that's wet to the touch. If you still can't tell, a quick feel of the diaper or look inside it will do the trick. If baby is sleeping, there's no need to wake him for a diaper change. Unless your baby is very wet and uncomfortable or has a poppy diaper, you don't need to put a new one on during nighttime feedings, either, especially if it will interfere with your child going back to sleep. Girls need to be wiped from front to back, to avoid getting poop in the vaginal area. Front-to-back wiping is important to reduce the risk of a UTI urinary tract infection. Make sure to wipe away all stools between the labia and groin region. Boys may offer an unwanted surprise in the form of a fountain of pee, so keep him covered with a clean diaper or cloth whenever he's undressed. Don't be afraid of gently cleaning around the penis and scrotum. For circumcised boys, your pediatrician may recommend that you gently retract any extra skin near the top of the penis. For disposables, wrap the diaper into a ball, using the tab fasteners to secure. Then throw it away in your diaper pail, plastic bag or trash can, but never flush it down the toilet. When you're away from home, carry a stash of plastic bags. Place the dirty diaper inside and tie the bag before tossing it into the trash. Put cloth diapers into a bucket with a tight-fitting lid, or a vinyl bag if you're out, until laundry day. Once you've gotten a fresh diaper on your baby, change his clothes and sheets as needed or redress him. Finish by washing your hands again. Use hand sanitizer or wipes if soap and water aren't available. As a rule of thumb, that nanny avoid using baby powder made with either talc or cornstarch during diaper changes or bath time. That's partly because babies don't really need it and powder can irritate their already sensitive skin. And partly because if a lot of powder is inhaled, it can be harmful to little ones. You also do not really need baby lotion, baby oil or other creams when you're changing baby's diaper, unless your baby has a diaper rash or a history of repeat rashes. If they have particularly sensitive skin and seem to get rashes a lot, you can use ointment with each diaper change. In that case, you should use a barrier ointment. Plain old petroleum jelly often works, or a zinc oxide cream if your baby is in disposable diapers. Diaper ointments are generally not compatible with cloth diapers, so check with your pediatrician about what to do in that case. Be sure to give baby's bottom at least a couple of minutes to dry before applying the cream and diapering. If the rash isn't gone in 2 to 3 days, or you notice a fever, blisters or pus draining from the rash, see your baby's pediatrician. These can all be signs of a skin infection. Teething. Most babies start developing teeth at about 6 months of age. During this teeth breakthrough time, babies often become irritable and fussy. If your baby is having diarrhea or fever during this time, you can contact a healthcare provider to ensure that there is no other underlying problem. Other than these, you also need to take care of the baby's urination, frequency, vomiting, weight gain, sleeping habits, etc.